We now talk about liver 6, another she cleft or accumulation point. This is located 7 proximal to the highest prominence of the medial malleolus, just posterior to the medial crest of the tibia. Needling 0.5 to 1 vertically or obliquely in a posterior direction towards the fibula, or transversely, subcutaneously in a proximal direction along the tibia. How to find liver 6? First, locate the highest prominence of the medial malleolus. From there, palpate 7 the width of 2 hands and 1 thumb, in a proximal direction, and there locate liver 6 in a depression directly posterior to the medial crest of the tibia. Or using the quick method, spreading hands technique, place the little fingers on the medial end of the popliteal crease and the highest prominence of the medial malleolus, respectively, and join the thumbs on the posterior border of the tibia at the midpoint of this distance, which is approximately 15 tun. From there, measure 0.5 tun in a distal direction, and here locate liver 6 posterior to the medial crest of the tibia. Some texts locate liver 6 on the tibia, others on the posterior border of the tibia. Sensitivity to pressure should be the determining factor. Liver 6 is used to clear heat and regulate qi. Related symptoms include hypochondriac pain and abdominal distension. This type of qi level heat is often associated with recovery from acute hepatitis. Other qi level heat conditions that can be addressed with liver 6 include tonsillitis, abdominal infections, and inflammation in the joints. It is also often used in treating premenstrual syndrome and dysmenorrhea of the type where the patient feels abdominal discomfort after the period has finished. All of these symptoms involve a compromise of the liver function of directing the flow of blood. When adequate blood flow is not maintained, heat can develop. By unblocking the flow of channel qi with a cleft point, this function of the organ is stimulated. The name indicates that Zhongdu is located in the center of the shin bone, where the point is found in hollow. It is also a she cleft point where qi and blood accumulate and mingle as people do in a city. This accumulation of blood and qi makes she cleft points good to use when nourishing and strengthening our key issues. They can reinvigorate a person if their qi is stagnant or stolid. In the same way that all the exchanges and different cultures of a big city can broaden one's horizons, middle capital or liver 6 can help stimulate the mind and spirit of wood if it has become hidebound and rigid, and supports the liver with assessment, strategy, and planning, which are so important to the nature of wood. All she cleft points are useful for invigorating or dispersing pain or obstruction along the particular channel on which they are found and are much used in acute conditions. It shares many similar actions with liver 4 and 5 in its effects on the genital area, although as a she cleft point, it is particularly indicated in full conditions, acute situations, and to irrigate the length of the meridian. Machocha in 1989 cites it for acute urinary pain from damp heat and stagnation of liver qi. Liver 6 is the gaiety without worry point. First aid for spasm, cramp, urinary pain. Liver 6 is for general weakness within the liver, inability to stand, inability to walk, or where the legs are cold, numb, or painful. It affects the genital area because the meridian passes through this sector, so consider for excessive menstrual bleeding or hernial disorders, said to be a revitalization point for the whole body from the Japanese tradition.